Hey guys, Dr. Jason West with part 2 of alternatives to prescription medications, which is a frequently asked question that I get in the office all of the time. People say, I want to know if there's an alternative to my prescriptive medication. What can you do for me? And the answer is maybe. Maybe there's an alternative. It depends on your condition. It depends on your commitment to a changed lifestyle. And sometimes there's no options besides this prescriptive medicine. And other times there's tremendous options. So in the first segment, we talked about the commonly prescribed medications. The second segment, we're going to talk about the second 5. And a frequently one that gets asked about all the time is acid blockers, acid stoppers, and acid stoppers. So blockers, stoppers, and stoppers. So one of the frequently prescribed medications is Nexium, Prilosec, omeprazole. Now, not all of them are prescriptive medications. Some of them are now over the counter. But my concern with that is when you block acid in the stomach, it seems to have an enormous effect on other areas of the body. And if you decrease the hydrochloric acid, I think it's a risk factor for ulcers. So again, if you take your food and you put it into your GI system and it's not broken down correctly, what happens is it ferments, it rots, it decays. You get organic acid, not physiologic acid. It starts to come up before it goes down. And so if you block hydrochloric acid therapy by doing acid block, it's really, really hard on your system. So what is an alternative to those? Well, there's actually 2 pathways here. One is we want to increase your digestive ability in your stomach. So when you drop stuff down in your stomach, what you want to do is you want to make sure that it's broken down. So a type of digestive enzyme, you want to have a proteolytic enzyme which breaks up foods, proteins, carbohydrates, and fats. And if you do that, almost always you can get rid of heartburn and indigestion, stuff like that. About 15 to 20% of the time what occurs is you are creating too much acid because you have an overstimulation of the parasympathetic nervous system. The vagus nerve that controls everything is on full alert, or it's going full blast, and a simple mineral called phosphorus really helps to downregulate and helps with the GI system. So it's a simple test. You take a digestive aid. If it makes it worse, you know what to do. If it makes it better, you know what to do. Another frequently asked question is there an alternative to antibiotic therapy? And again, the answer is maybe, because there's definitely a time and a place for antibiotics. And being a natural medicine doctor that likes to stimulate the immune system and try and make the body healthy, sometimes that approach doesn't work in an acute infections, and antibiotics have saved millions of lives. On the flip side, antibiotics have been really abused as well, because the minute someone has an infection, it used to be that they would write an antibiotic prescription, but what if it was a virus? Or what about if it was a fungus or a yeast? And the antibiotic may not work on those, and actually it has a detrimental effect on the body. So my approach to infections, and we've had really, really good outcomes. Matter of fact, in the last couple of years, we've been able to save a couple feet and hands from amputation that weren't responding to IV antibiotics or hyperbaric oxygen by making sure that the body was healthy. So if your immune system is healthy, you are healthy. Now again, we talked earlier in a video about your phagocytic index, which is decreased by white sugar, refined sugar, high fructose corn syrup, which means that your immune system's ability to swallow up bad guys decreases exponentially if you are around a lot of sugar. And one of the worst things that you can do is to drink a can of soda, which has somewhere between 3 and 6 tablespoons of sugar in it. It really, really knocks down your immune system. Now, things that you can stimulate your immune system and make your immune system better: garlic, vitamin C, golden seal, echinacea. Some really advanced things for infection would be IV vitamin C and IV dilute hydrochloric acid. I've seen some amazing outcomes with that. But if you will take care of your system, your immune system, go to bed on time, eat right, move, decrease your stress levels, there may be some really good alternatives to antibiotic therapy. Another question I get asked all the time is about diabetic medications. Now, if you're on insulin, that's a totally different topic than what we're talking about. Mainly, we're talking about non-insulin dependent diabetes and things like Avandia and metformin and stuff like that, where people say, is there an alternative? And the answer is yes, I think there is. In some cases, you need to work with your doctor to make sure that you have all your options. But many times, pre-diabetes is a lifestyle choice. People are choosing to have a pre-diabetic profile. So reduce your carb intake, reduce your sugar intake, increase your essential fatty acids, get your sleep patterns right, And then what you want to do is move. Exercise is so important. Matter of fact, our next video, we're going to talk about all the benefits of exercise. Natural things that you can do for blood sugar regulation. Selenium's really important. Zinc's really important. Chromium's really important. Supporting the pancreas, the digestive portion, and the insulin creation portion of the pancreas through a glandular. So there's some really neat products available that give you all the building blocks for a healthy pancreas. And then also you want to make sure that you're eating consistently, because if high blood sugar is too bad, which it is, low blood sugar is really bad, and whether we call it reactive hypoglycemia or the new terminology with neuroglycopenia, which means if you don't have enough blood sugar, the nerves will fail. You can support that with cinnamon, with essential fatty acids. You can support that with the glandulars, chromium, your minerals. There's a lot of options for type 2 diabetes and non-insulin dependent diabetes if you're willing to make a lifestyle commitment. Another question I get asked all the time is about anxiety medications. Now, anxiety is when too many impulses go through your nervous system, everything gets through your brain, and stuff that wasn't bothering you before is increased. Now, that's really aggravated by stress, and sometimes there's some really neat anti-anxiety natural solutions, and sometimes there's no other option but to have a prescriptive medication. So prayer, meditation, yoga, deep breathing. I love it when people will journal, but there's some neat things that happens when we add what we call GABA, which stands for gamma aminobutyric acid. It decreases the ability for all the impulses to go through the neurosynaptic cleft and cause anxiety. There's a natural medicine from Nature's NX called Even Keel 9. There's something called Awesomeness Day. They really, really help to give the nutritional components to support healthy nerve tissue and to make sure that not all the impulses are going through and you're getting that short circuit where the littlest thing that shouldn't bother you really bothers you, or you go to a social situation, or you go to a doctor's appointment, or you go to anything that's not on your schedule and it's exacerbated. There's some really neat options for you. I got asked the other day if there's alternatives to Lunesta and Ambien. And the answer is possibly. Now, the longer that people are on these, it's been my experience that the harder it is to substitute something natural for their prescriptive medications. And you absolutely need to involve their medical or their prescribing doctor in this process, because if you can't sleep, you can't heal. And so the first thing I tell everybody is we got to make sure that we have a sleeping sanctuary. And that means that where you go to sleep, that it's meant for sleep only. You take the electronics out of the area, you take the TV out of the area. You get people to in the best calm system that is possible, and usually that is writing out their thoughts, prayer, meditation, and deep breathing are all factors. Some of the natural things that work really well for that are magnesium, and there's some anti-anxiety stuff that we talked about earlier, Even Keel 9, and also something called Awesomeness Day, which is GABA aminobutyric acid. It's a product from a company called Nature's NX that really help to take all that little woodpecker impulses when you're trying to sleep. Now, what do I mean by woodpecker impulses? It's a little bird that sits on your shoulder and says, well, what about this? And what about this? And what about that? And your mind can't shut off. And if you can help your mind to relax by journaling and writing down your thoughts and taking some of these natural things to help calm you down, it really helps with sleep patterns. The other thing that I see that works really, really well is to have some protein before you go to bed, because I think that there's a blood sugar component as people are trying to get to sleep, or they don't have enough protein in their system. The body uses up those reserves, those sugar reserves, and then what happens is the nerves freak out and you get keyed up. And if you'll have a little bit of protein, some cottage cheese or beef jerky or beans or even some natural cheese before you go to bed, I've seen it really help get people to calm down and sleep through the night. The last thing that we have on part 2 of alternatives to prescriptive medications is depressive medications, or depression medications is what I should say. These are things like Zoloft and Paxil and Wellbutrin and Prozac and things like that. And the answer is on those. Sometimes there's a good natural alternative and sometimes there's not. You need to work with your doc on coming off of these medications. However, if we regulate your nervous system function, we can reset the nerve by doing something called neural therapy, which is the little tiny injections in the different acupuncture and nerve control points to get your nervous system to open, close, and reset. Diet is absolutely key in considerations for depression medications. If you're abusing yourself by having too much sugar, not eating correctly, it seems to exacerbate any depression tendencies or capabilities. Now, when people are having long-term clinical depression. I have found people that are on that have clinical depression that have been on antidepressant medication for long periods of time. It's fairly difficult to give them something natural that will do the same thing as those depression medications. But regulating lifestyle and giving things to support the nervous system. I like a product called The Electrician. I like something called EMC Squared from Nature's NX, are really helpful for conditions like that. Getting out and moving, having healthy relationships, doing some mind healing are some of the things that we can do to incorporate so you don't quite need as much depression medication. And that is the 10 medicines that we're looking for alternatives for.
Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.